Hi, Juno News. Alexander Brown here, host of Not Sorry. Great to be back with you. I'm the director of the National Citizens Coalition. I'm a writer, a campaigner, a columnist, contributor. Thrilled to be busy in this space. Thrilled to be here with you 3 days a week. And while you're here, if you like these episodes, junonews.com/not sorry for 20% off. Great deal. There's so much great reporting on Juno News. So many talented folks. Please check it out. Please support us. So, slowly, surely, reluctantly, Canada's so-called harm reduction and safe supply model of permissible and government-supplied drug use, it's collapsing. And it must. The public doesn't want it. It's dangerous, antisocial, anti-civilizational. It's an experiment that's destroyed our towns and cities. And that hasn't helped get our troubled and addicted clean. We have these kinds of poverty pimps that claim it work, that make all kinds of excuses, but keeping these folks in a continued state of suffering instead of getting them off the streets and into treatment. The data doesn't back up that that's the right approach. Like, sometimes you need to have a firm hand with these things. And on the safe supply file, we're even seeing an NDP Premier Wab Kinew presenting what Adam Zivo calls, our guest today, a worthy plan to lock up meth addicts. What a change this represents over the failures of the last few years. This is still the year where the federal Liberals were quietly forced to admit this wasn't working and walk back their disastrous support of this safe supply and its permissible drug culture from coast to coast. BC has repealed its own disastrous public drug use laws that had legalized consumption in parks where children play, even hospitals. Police had just absolutely no powers. A large part of that is because of the work of our guest today, of Adam Zivo, a columnist, a journalist, an advocate in the more responsible drug space. He has an event coming up as well in Toronto that we're gonna talk about, because he's doing vitally important work that's in partnership with Project Ontario, because there's a role that the provinces can certainly play. If Wab Kinew can step up, Doug Ford can step up too. Let's talk to Adam Zivo, and thanks for joining us. Adam Zivo joins the show. He's a National Post columnist, a correspondent with the News Forum, founder and director of the Center for Responsible Drug Policy and Break the Needle. Adam, thank you for joining us.
Thanks for having me.
It's a pleasure to talk to Canada's leading advocate for common sense on the drug policy front. Now, your latest piece from this week, and credit where it's due to Manitoba NDP Premier Wab Kinew on clearly understanding the failures of harm reduction policy. You state that this is a worthy plan that he has to lock up meth addicts. I believe a quote from the piece is, "People who are suffering from meth addiction do not have the right to determine how the rest of us are going to live in our society," declared the premier. Are you optimistic this kind of pushback from I say often risk averse politicians that it'll catch on? And what's the sort of more work to be done piece that you flesh out in your writing? Can we trust them to see this through and see these next steps through?
Well, I think that his plan it indicates that there's a change to the national zeitgeist when it comes to drugs and crime and addiction. We've passed the main hump of peak harm reduction, and we've begun to focus on recovery, abstinence, prevention, and ensuring that drug addicts aren't given free rein to terrorize the people around them. But before I go into my assessments of Kinew's proposal, I want to just give a quick overview of what it is. So essentially, before he changed the law, if you had someone who was publicly intoxicated, they could be detained at a police officer's discretion for up to 24 hours. And that system was oriented towards alcoholics, right? If you're publicly drunk, we put you in a drunk tank, which is basically just a jail cell. And then with alcohol, you sober up quite quickly. So within 24 hours at the most, you're let out. The problem, though, is that the system is not designed for people who are using harder substances that have longer lasting effects. And it's a particular problem for someone who is using meth. The effects of meth, the main effects, last up to 12 hours, which falls within that 24-hour timeline. But when you come off of that drug, you go through a crash, which can last for up to 3 days. And during the crash period, people can be deeply aggressive, violent, and their behavior can be borderline psychotic. And this is especially true if they're coming off of a binge where they haven't slept for several days. So obviously, if you detain someone who's publicly intoxicated for meth use and you let them out within 24 hours and they're still violent and they're still crashing, that's not ideal. this person is still a danger to the rest of society, and you're not segregating them from society in the way that you should. And so what Kinew did is he changed the law to allow for detentions of up to 72 hours, which of course then encapsulates that period. And he's building a set of new facilities that are specifically earmarked for these longer stays.
Smart.
And what that means is that you'll still have their traditional drunk tanks, which are for people who are drunk on alcohol. But if you do stay for longer than 24 hours, they'll send you to a special protective custody location. And there you will be assessed by a healthcare professional every 24 hours for up to 2 visits, depending on the length of your stay. And there will be other compassionate supports available to you, including some addiction services. So, on my end, I think that this is clearly a step in the right direction, because when you have meth addicts who are, in the middle of the streets and making everyone uncomfortable, that's bad for society as a whole, and that's also bad for the addict himself, right? Because he's not getting the level of support that he needs, and he's not
Yeah.
going to get that support in the traditional drunk tank. So, if you segregate them from society for a longer period of time, you're keeping everyone else safe, and you're increasing contact with the healthcare system, and giving some level of support, which gives this person some option of recovery. Now, where I think that this doesn't go far enough is that it doesn't actually provide really substantial recovery oriented supports, right? So there's this big debate about involuntary care, and Kinew's plan has been characterized as a form of involuntary care, and that's true, but it's only the most basic minimum level of involuntary care. Involuntary care, in order for it to work, requires a longer stay, and that's why in the United States, involuntary care systems, often mandate stays that last for weeks, if not months,
Hmm.
because addiction is a very difficult thing to break. So if you're in a detention center for only 3 days, you're probably not going to get better, right? And even if you are repeatedly detained again and again and again and again, you're getting very fragmented care that is a poor substitute for a structured longer term stay. So I think that the better alternative to Kinew's plan would be to further criminalize public intoxication. So that way, people who are a danger to themselves and others can be more stably segregated from society for longer periods of time, rather than having a revolving door of detentions. And then to give people the option to seek mandatory treatments, or sorry, I guess, well, quasi voluntary treatments in lieu of jail, because that kind of structured longer term stay would be more effective than having someone stay and get some addiction care for 1 or 2 days every once in a while.
Yeah, that's one of the. I'm in Vancouver, and so I see so much of your great writing and news breaking on this file firsthand, which is that even if they do receive care, they're heading right back to East Hastings. And how are you supposed to stay clean, when those are, you're returning to those conditions after 24, 48 hours after some hold. It's seemingly one of the cardinal sins out here. And I'm still getting used to the ecosystem. I'm an Ontario boy originally, is closing down some of these facilities where you would be, kept for longer than just a cup of coffee, where some people's addiction journeys, they last their entire lives, and you can't just expect them to dry out and sober up and, that's it. No more meth for me.
Well, so what I'll say is that Kinew's messaging around this reform has very much been focused on public safety. And
Hmm.
said last week that we're going to take Manitoba back and make the province safe again. And I think that this system of longer detentions will certainly achieve that, right?
Yeah.
Because at the most basic level, you're segregating people from society for a longer period of time. And police officers might be more willing to detain people this way if they believe they have to re-detain them less frequently compared to what was happening earlier.
Yeah.
Uh, and so, from a public safety standpoint, I think this works. Sometimes it feels like the recovery oriented elements was tacked on later to give it a more compassionate face,
Yeah.
to give the impression that this is about really like about providing healthcare, when it seems more about finding a workaround for getting drug addicts off the streets. Because if you were to use the traditional criminal justice system, I mean, with our current bail system, you really wouldn't be getting anywhere.
No, the cup of coffee in their back. Yeah, you talk to cops and they're just going like, The frequent flyers drive them nuts. Like our cities, our downtowns, they have these super offenders that we all know about, like this percentage of, it's maybe only a couple dozen people per central business district, where if they were kept in care for longer, and we'll use care there in quotation marks, I suppose, but if they were kept in some sort of extended stay, if they were better looked at and not just immediately kicked back out, our legal system has its problems and its leniency issues increasingly, but that would make a major difference in these metropolitan areas almost overnight. Like if you just stop letting the same group of people continue to maybe have this 72-hour meth binge and come down, that Vancouver, downtown Vancouver, might be a place that people actually want to spend time.
That's the thing. And so actually there was a letter that was published, I think back in 2022, 2023 by a series of BC municipalities. And they, in that letter, included data showing that just a small number of people, I think maybe a few dozen,
Yeah,
uh,
it's really small.
yeah, were responsible for thousands of police interactions.
Yeah.
And I think last year, the city of Kelowna published a report that indicated that I think maybe 15, 16 people were responsible for hundreds of police interactions. So you have a very tiny number of people who are causing this wildly disproportionate amount of public disorder and crime. And we just let them get away with it and prioritize their interests over the interests of society as a whole, which is a problem.
Yeah, it's got to end. And on the maybe misplaced priorities here, CBC just dropped a 40-minute documentary that seemingly seeks to undo some of these words from the Manitoba Premier. That seems to go in the other direction. From your terrific work. When you hopped on this call, I know it was bothering you. Let's talk about what the CBC just published here and what your thoughts are.
Yeah, so I want to clarify that the CBC documentary is not in response to Kinew's stuff. It's actually in
Yeah,
response to the federal government defunding its safer supply programs.
yeah,
So, for people who aren't aware, safer supply is this program where we prescribe addicts pharmaceutical grade drugs with this idea that it dissuades them from using the illicit supplies. So, Alex, let's say you were addicted to fentanyl, you're buying it off the street, it could be contaminated.
I am in Vancouver. Yeah,
Yeah, you're respecting the local culture.
yeah,
And so the idea is that we would give you bottles and bottles and bottles of hydromorphone, which is an opioid as powerful as heroin,
yeah,
uh, with this belief that it will dissuade you from using the street supply. Oh, and there's no supervision in consumption because that would be stigmatizing and would be a barrier. So, anyways, you do the rational thing in this situation. Fentanyl is 50 times stronger than hydromorphone or heroin. So you sell your free government opioids to make money to buy illicit fentanyl. So we're not actually mitigating the use of the illicit market. We're subsidizing it, and we're flooding our communities with pharmaceutical opioids. Um, I wrote a lot about this. My first report came out in 2023, and I thought at the time that it would change things, but essentially, the federal liberals and the BC NDP, they ran with the narrative that this was disinformation, that it was unscientific, even though I have a very large pool of addiction physicians who support my claims.
yeah,
Um, and so then I ended up publishing over 50 follow-up articles and op-eds about this, very concretely illustrating that safe supply diversion is a major issue. Uh, the London police in Ontario indicated the hydromorphone seizures exploded by 3,000% after safe supply access was expanded, and that organized crime at the highest level is involved in the trafficking of these drugs. In BC, they mandated witness consumption after a leaked ministerial report showed that the government was aware of widespread diversion. So eventually, the federal government defunded the program this year. Thank God, quietly. But of course, all the harm reduction activists are really mad about that because they don't want to accept the fact that their experiment failed and harmed people. And the
yeah,
CBC is not really journalism. They call themselves, like the Fifth Estate calls itself, investigative journalism. They released a documentary that was essentially a PR puff piece for Safe Supply. And so what they did is they interviewed all the harm reduction activists. Like literally, the
yeah,
documentary consists of just interviews with drug addicts and harm reduction advocates and completely ignores all the medical experts who oppose safer supply and who think that it's a terrible idea.
yeah,
Right. And then it presents this narrative that opposition to safer supply is unscientific and that it is rooted in fear, stigma, politics, all this stuff. And they're very clearly trying to say that the conservatives, by opposing safer supply, are killing people, and they're unscientific. Um, Now, if you're going to make that argument, okay, fine. You need to also include the people who, the medical experts who are against safer supply, but they didn't. So they're strategically withholding this information from their viewers to avoid addressing the fact that no, opposition to safer supply is not a political thing. Well, it is political in a certain sense, and that health policy is always political, but it's not, some irrational thing. It's rooted in people's clinical observations about diversion and its impact
Yeah. Yeah.
on drug addicts. And so it's the CBC once again engaging in activism and calling it journalism.
And the polling, like I don't think polls should always be used to dictate policy. We can get all kinds of things wrong as a general public, but like overwhelmingly so, Canadians don't believe in these programs anymore. They were sold one thing and now see another. Their kids can't play at the local park because there's a guy passed out on the bench with needles around him. It's like we all have eyes, and we can all tell what's happened to once great towns and cities. Adam, you've been an outspoken critic, a great piece recently in the City Journal, I believe, of portions of the LGBTQ movement that have seemingly become radicalized or lost their way, and some of the impacts that's had on harm reduction policy, or even the highly contentious topic of pediatric gender care. Has this been to the detriment to what that movement is supposed to be all about? To what extent have some of these organizations and organizers lost their way?
Well, so the point of that article is to illustrate how these two different policy areas, which on the surface seem completely unrelated, actually stem from shared sensibilities and a shared history.
Yeah.
So the harm reduction movement, began in the late 80s, early 90s, really got its traction then in response to the HIV/AIDS epidemic. And the idea is that if you gave people clean needles, that you could reduce HIV transmissions. And so many radical queer activists, I think quite understandably, ended up running these illicit needle exchange programs that were illegal, right, at that time. And in doing so, they ended up connecting with many nascent drug reform activists and addicts. And so from the very beginning, you had this alliance between LGBTQ activism and harm reductionism. And then that only strengthened over time because they both shared a hostility towards capitalism, towards the moralizing norms of society. And their radical ethos really built this like persistence relationship. Now, the harm reductionists ended up actually learning a lot from the LGBTQ activists, which is why in the 1990s, many drug reform activists spent a lot of effort into rebranding drug addicts as a persecuted group, akin to gays and lesbians or racial minorities. And they were fairly effective in doing that. Now, this relationship between these two groups ends up solidifying in the 2000s because after the HIV/AIDS crisis was mostly managed, many of these organizations, HIV/AIDS organizations, didn't really know what to do, right? They had to find a way to continue justifying their funding and their existence. And so they pivoted to addictions on the basis that they were really good at working with addicts in the context of infectious diseases. But these people didn't have a background in addiction medicine. And so these HIV/AIDS organizations, which had a lot of radical LGBTQ activists, ended up pushing for really radical forms of harm reduction, like drug legalization and supervised consumption sites. And that's why when you look at the harm reduction space, many of the people who are in there are coming from HIV or AIDS backgrounds, right? And so you see this continuing relationship. And then in the 2010s, both of these movements end up gaining a lot of political and social traction. And you can see commonalities with how they bring people on side. So what they would do is they would often produce a lot of bad research and rely on the public's scientific illiteracy to give the impression that certain interventions were evidence-based when they were not. And we saw that with pediatric gender medicine, where the evidence base and support of sex changes for kids was really, really, really weak.
Yeah.
And the studies behind it were really weak as well and not representative.
a,
You would,
a mile wide and an inch deep. Like you'd see all this commentary and flowery words, and then you actually look at the graphs and the data, and you're going like, "What the heck is this?"
yeah, I mean, you're looking at people mass producing low quality evidence and then
Yeah,
using that to create the impression of scientific consensus where none exists.
yeah,
And the same thing happened on the harm reduction side, where you had a large number of studies which claimed that safer supply, for example, worked. But when you read the studies, they were really, really terrible. Like you would have most of them essentially
yeah.
were yeah, we interviewed about 20 to 30 drug addicts, and the
We
addicts,
asked Guy Felicia in Vancouver if this works, and like,
yeah,
yeah, it does.
well,
Yeah,
it's like, yeah, we interviewed the drug addicts. The addicts told us they like the program where they get free drugs, and they
yeah.
told us that they're not selling the drugs, and if they do, it's only mutual aid. So I guess this is the thing we should do,
That's
right?
a really reliable audience there to be
Yeah.
sampling inside of. Yeah,
And then what they would do is they would give a sense of moral urgency. And they would say, if you don't support safe supply, you're killing drug addicts. If you don't
yeah,
support pediatric gender care, you're killing trans kids. And they would use this sense of moral urgency, this hysteria, to silence their critics who said, well, actually, the evidence base here is not very solid. And so by the early to mid 2020s, people started to notice that there was a problem here. And now you have a backlash against both movements, to the point now where the activists who are working in these spaces are actually saying, "Oh yeah, well the future of harm reduction and LGBTQ rights are tied hand in hand, and we have to defend them together." So,
yeah,
when you look at the things that have gone wrong in society with these two big policy areas that everyone cares about, they are way more connected than you would assume.
yeah. And what to the detriment of both of them? Like, why can't we just walk and chew gum at the same time? Why can't we stay on equity and inclusion and stay on responsible drug policy? Why does it have to turn into some radical shared log rolling exercise and some extended excuse for further harm in the community? I mean, Adam, you're involved with Project Ontario. I'm a contributor as well. You have a great piece with Josh DeHaas where the two of you talked about 4 ways to solve our growing crime crisis. That's been an interesting assembly of the Ontario Conservatives, principled folks who don't love what they're seeing from Queens Park. And you're not just writing about it; you're holding an event. You have, I believe, it's coming up on November 26th in Toronto, in partnership with Project Ontario. Can our viewers today secure tickets and tell us a little bit more about it?
Yeah, they can. It's only $50. It's at the National Club, which is a really nice space, and we're going to
It's
have a
beautiful.
screening of my short documentary, which is 30 minutes long, Government
Great.
Hero 2, which features basically crying kids talking about how diverted safe supply destroyed their lives. So bring a tissue. It's going to be hard to watch.
Yeah.
And then we have a fireside chat between myself and an addiction doctor, and a fireside chat between myself and someone who was harmed by using diverted safer supply. Uh, Now, the reason why this event is relevant is that although the federal government defunded its safer supply programs, safer supply primarily exists at the provincial level. And what I mean by that is that when someone gives a safer supply prescription, they're basically just prescribing a drug off label like they would in any other case. Um, and because healthcare falls under provincial jurisdiction, if you want to stop that practice, you need the province to step in. Alberta has stepped in and has prevented, like banned all safe supply prescribing. BC nominally requires witness consumption to stop diversion, but in Ontario, it is the Wild West. And in Ontario, safe supply is actually the worst, and in any other jurisdiction.
You'd
And
think it'd be BC. That's surprising to hear.
yeah, you think of BBC? No, it's
The
Ontario.
conservative three-term majority premier.
Yeah, and the thing is that Ford has said that he opposes safe supply. And last year he wrote a letter and that was directed towards Trudeau, and he said, "We want you to stop funding these programs. We have no clue how much hydromorphone is getting into our communities through this program." And it's like, well, first of all, you could stop it yourself at the provincial
Yeah,
level, like Alberta did, but of course they just want to blame Trudeau rather than take responsibility. And second of all, of course, you know how much hydromorphone is going into your communities because it's all paid for by OHIP. It's all paid for by the
yeah.
provincial insurance plan. So we have the Ford government not making any moves here. And as a result, there are so many opioids, like just millions of tablets that are flooding into our streets, and Ford isn't doing anything about it. So this event helps raise some awareness about that and calls for provincial reform to fix this problem, because just because the federal government is no longer supporting safe supply doesn't mean we're out of the woods yet. We need the province to take action.
Yeah. And you don't sound like a radical right or a Yahoo to me for saying that, as he's sort of flippantly described folks who are chipping in on Project Ontario. That sounds like a great event. I'm going to put the link in the episode notes for Juno supporters to check out. Adam Zivo, thank you for joining us.
Thanks for having me.